Back to follow-up segment tonight. As you may know, President Obama's health care vision in deep trouble. Simply put, it's chaotic. And according to the Congressional Budget Office, very expensive. 3 questions. What's the best thing about Obamacare? What's the worst thing? And what the heck happened in Massachusetts when they passed universal health care there? With us now to answer those questions, former Senator Bill Frist from Tennessee, a medical doctor and author of the upcoming book, A Heart to Serve, which will be released in October. Now, I know you were an expert on this, but I want to just boil it down. No plan is all bad and all good. So let's get the good things about the Obama plan. What are they?
Well, and it is worth saying because there are some good things in there. They're more bad than good, but the good things. I would list them. Number one, it does get a lot of the hardcore, uninsured, the people who really don't have access to health care at all. Literally can't, except going to the emergency room, but it comes too late. Number two, there's a lot of stuff in there that empowers consumers. If you want markets to work in healthcare, and I believe that they can, I honestly know that they can, but consumers, the patients, people out there have to have accurate information. How good a doctor is, where to shop,
right, so more information so people can make educated choices.
More good education, good education, now the good material, and that does mean information technology, and the Obama administration has invested in that. We'll see if the payout is there. And the third thing that is in there is this overall trend to reward and incentivize and align incentives around rewarding outcomes, good outcomes, reward just more procedures.
That means if my cold is cured, the doctor gets more money?
Well, that's right. Or if a bad doctor's out there basically hurting people, that they don't get as much money, but it does mean paying for performance.
So there is a ranking of doctors and their subsidies based on that?
And the incentives, instead of healthcare just doing more and more of everything, more x-rays, more MRIs, getting CAT scans, MRIs, x-rays, keep repeating things to basically say what gives you the best value. So you're rewarding value and not just volume of health care. And those are good things.
Bad things.
Well, the bad things are a lot. I think the first one the American people now understand is the $1.6 trillion in cost.
Okay, too much money.
Too much money coming in that we just can't afford with people going bankrupt every day. Number two is what people call the public plan. And this public plan, though, is a single-payer, nationalized plan where decisions have the potential for being taken away and loss of innovation for people who are looking for cures in the future. We don't know if that's what's going to happen with this so-called public plan. It's an experiment, and people aren't ready to experiment in this case.
You worked in the British healthcare
I did. I spent almost a year as a heart surgeon.
Was that chaos there?
It was rationed health care.
It was rationed.
People waited a lot longer to come see Bill Frist.
And that could happen here, right?
Well, if we went to a socialized or a nationalized and then socialized system, it would have to occur here.
Right.
It definitely would occur here.
Okay, so that's what I'm worried about, too. The older people, they say, look, you know, you're 80. We're not going to give you the procedure because we got to give it to somebody who's 50. And you're going to check out soon anyway, so see it.
We don't know that's what would happen with this nationalized single-payer plan. Well, what would happen potentially if we put a public plan out there, nationalized single-payer, it would pay doctors less, pay hospitals less, it would be a cheaper plan, and therefore the 160 million people out there who have lots of choices today in private health insurance would be dumped into this public plan, which would grow and grow and grow, and if it did that, it would take away choice, and it would take away new technology.
Now, Massachusetts Governor Romney passed universal health care, and it did get most people insured. But right now, they're paying $600 million more for health care than they did 3 years ago in Massachusetts, and the state's bankrupt.
It's a little bit the same story. On paper, it looked good. It did take the number of people insured from 93% up to 97%. And I would argue that is a good thing. Not everybody agrees with that, but having some insurance as a doctor is good for the patient. The problem is it's done a couple of other things. Cost, instead of going up at 6% predicted, spending has gone up at 10%. The same sort of thing.
The state's on the rocks.
Well, the state, and right now it's not in a position to be because of the overall economy. But also, if you look at Massachusetts, how long you have to wait for a specialist. It's the worst in the country. In Boston, Massachusetts, and that's where I trained. I spent 10 years.
And they have the most doctors up there.
The most doctors anywhere in the country per capita. You have to wait 50 days for a specialist, where in any other city in the country it's down to 20 days, and that's getting worse under this new plan.
Senator, thanks very much. We're looking forward to your book, and you'll be back with that, I hope.
Great to be with you. Sure will.
We come right back. Hide the kids because Glenn Beck's wearing lederhosen.